Today I'm going to be performing tracheostomy care as well as suctioning. Before I enter the room, I want to check over the patient's chart and gather all the equipment necessary. So I'll knock on the door, perform hand hygiene. Hi Susie, how are you doing today? Good, my name is Julia. I'm the nurse going to be taking care of you today. All we're going to be doing is suctioning out your trach and putting a new one in for you. So before we begin, I'm going to ask you for your name and your date of birth. All right, thank you so much. And then what kind of pain are we having today? 0 being no pain at all, 10 being the worst pain you've ever felt. 0, all right. And last time we did this, did you have any medications whatsoever? Perfect. So before I begin, I will want to make sure I have the bed raised up to the proper height for me to work. Put down the bedside railing. For privacy, I want to pull the curtain over, and then also when I'm doing the suctioning, I want it to be in semi-Fowler's position because Susie is conscious as well. So the first thing that I'm going to do is perform hand hygiene one more time, put on a pair of clean gloves. And I will begin oral care. So I'm going to put this pad down, make sure Susie stays dry. And I can connect my suction tube. And then get out my pad for cleaning. So I want to use water, a little bit of toothpaste in order to clean. While I'm cleaning, I'll suction it out as well. All right. Looks all clean, so I can get rid of this, take off my suctioning tube, and then I can begin to suction the trach and provide the rest of the care. I'll take off my clean pair of gloves. And I want to make sure I have all of my sterile equipment prepared. So I have my little box open that I'm going to put my saline in. I can open this, and the inside of this is sterile as well. So I'll put the cap case up, open up my sterile catheter, and open up my trach kit as well. And now I can begin to put on my sterile gloves. So I'm going to take my catheter with my dominant hand. I can hook it up to my suctioning. I want to make sure I have good control over this as well because I don't want to touch the outside of the trach. And I can begin suctioning. So I'll get a little bit of my saline solution, and then I'm going to put it inside. I don't want to have this held down, and I want to make sure I'm not touching the outside. And I'll use the proper length as well. For this, it's going to be about 16. And I'll hold it down. I'm going to be making circular motions. I only want to be having this for like 10 to 15 seconds at most. All right. Clear that out, get some more saline. Go back in because it looks like we have a little bit more left. I don't want to do this more than 3 times as well. All right, since that looks all clean, I can go ahead and take this off. And then after that, I'm going to replace the old trach with a new one. So I will remove these now dirty sterile gloves, perform hand hygiene, and then put on a new pair of sterile gloves. So I also want to make sure I'm taking out this old gauze as well. Should have done that a little bit earlier. And then when I go to take this out, since this one is disposable, I'll just get a new sterile one. And then as that's out, I'll take my Q-tips, put it in our solution and clean around it. I want to use a new Q-tip with each wipe. Perfect. And now I can put my new trach tube back in. All right, so now that that is all clean, I will also dry off with some gauze for any excess wetness. Need to make sure everything stays dry. And then I can begin to take off the collar and put on a new one. So I'll untie this from the back. I'm gonna guide this out. I'll get a new collar and guide that one in as I'm guiding the old one out. Same with the other side. Guide that one out. And guide the new one in. You still doing okay, Susie? We're almost done. All right, so now that I have that guided in, I will tie it in the back, and I want to make sure that it's not too loose but not too tight as well. After that is done, I will put clean gauze around in case there's any excess secretions. All right. And then once that's done, I can take off my now dirty sterile gloves, perform hand hygiene, and then I'm going to clean up my area as well. So I can take this pad away, make sure that this is all cleaned up as well. I'm gonna put my bedside railing back up, make sure Susie has her call light, put the bed back down to its original height. And then Susie, do you need anything before I leave? Was that painful for you at all? You still doing okay? All right, well, thank you so much. Please let me know if you need anything. Just hit this call light right here. All right, thank you.